So we've learned that increasing the intensity of the conditioning regimen is important to give the best outcomes after allogeneic transplant. A randomized BMT-CTN study compared fit patients either to a myeloablative conditioning regimen, which is intensity of chemotherapy and radiation sufficient to eliminate most, if not all, of normal stem cells, versus a reduced intensity conditioning regimen, where some recovery of normal host-type hematopoiesis might be expected. The results of that study were clear. Patients who received the myeloablative conditioning regimen did better, with better disease control, better relapse-free survival, and better overall survival. However, not all patients are fit and can tolerate such aggressive chemotherapy. We and others have been exploring ways of optimizing the chemotherapy without the toxicity associated with high doses of radiation that were typical in the myeloablative approach. In particular, 3 days of busulfan coupled with fludarabine and thiotepa appears to give very good disease control in patients with myeloid malignancies. And for frailer patients, the dose of busulfan can be reduced to 2 days without sacrificing clinical outcomes. These approaches, using drugs which are FDA approved, allow us to tune the dose of the conditioning regimen to the particular patient to give the optimal results.